Theoria Medical was started in 2019 with one simple mission and vision for post-acute care. We wanted to provide a tech-enabled, comprehensive primary care solution, all set within a value-based care setting. We are the only solution in the marketplace that when we enter into senior living, community, facility, skilled nursing, assisted living, IL, CCRC, we provide a comprehensive service to our partners. That's inclusive of primary care services that are on site, medical director services, all the analytics around those services, and then we put this all within a tech-enabled service where we're providing all of the proprietary technology along with those on-site services as well. It was very clear to me that not only would Tutera be a great partner for Theoria, but Theoria would be a great partner for Tutera. The partnership just made sense because we both put resident and patient care at the center of everything we do. So one of the biggest problems in healthcare today is disjointed care, lack of continuity of care. We hear about it all the time. So Theoria, what is centric within all of our technology and what is centric within all of our solutions is that continuity of care and providing our residents and patients with the best environment that they can really excel and get to the highest level of baseline that is achievable for them. So the Theoria telemedicine is delivered by Theoria providers, and those Theoria providers are full-time telemedicine or virtual rounding providers. So they're not on call for that night. They didn't work a day shift where then they're working at night as well. Those providers are trained as telemedicine or virtual rounding providers. They work as virtual rounding providers, and that is their sole purpose in the Theoria model. The residents have continuity of care because it's the same virtual rounding provider covering the same facilities, covering the same residents. It's essentially just a provider in a virtual sense that also complements the physical provider. Theoria telemedicine providers are communicating with nurses, not only verbally and through our secure messaging platform, but they're also documenting, and all of that documentation is pushing directly into the facility EHR. So it's literally enabling continuity of care in every way possible. So imagine a world where you have a second shift or third shift nurse who has to make a clinical decision and they're no longer alone. They can contact a provider, they're talking directly to a provider, they have their direct contact number. So RPM is remote patient monitoring, and with a remote patient monitoring service, you receive respiratory rate and heart rate, and those are good indicators of what's going on with a patient clinically. It also gives you early indications of certain disease processes, and also gives you the ability, or the provider the ability, to know if a treatment is going well or not going well once they've initiated that treatment. So then coupling that with telemedicine and also the presence of providers physically, you have a 24/7 model where patients and residents are being monitored continuously for improvement in their care and to ensure that they receive the best level of care. So the CCM program, or Chronic Care Management Program, is a program that to me is one of the most important programs in post-acute care today. The reason being is because the Chronic Care Management Program sets time aside for a provider or for a virtual team to review patient charts, to review chronic diagnoses, and to really dig into each of the chronic diagnoses that a patient or resident may have that a provider that's seeing them for an acute visit or for an acute issue may not be reviewing or may not have time to look at it during that specific encounter. What's very unique about both Tutera and Theoria is that partnerships really truly mean something deeply important to both of us. It's a partnership not just for the mere sake of business, but it's a partnership because of alignment of vision and mission. And both believe in tech enablement and being at the forefront of technology to thus enable better outcomes and better care to patients and residents. And also, we put our people first, which is so rare in healthcare.